Picture this. It's 10 a.m. on a Sunday. Bright sunlight pours through the blinds and into your eyes. You're seated at a table with a blank sheet of white paper in front of you and a box of crayons to your right. Endless colors with endless possibilities. You haven't been feeling too fantastic lately, so you start drawing what makes you happy. It calms you. Imagine taking this exact experience and turning it into a profession. Art therapy. Now, art therapy is so much more than just scribbling on a sheet of paper and talking about your feelings. It's all about that end result, the calmness, the lack of anxiety and fear, using the power of art to ease the qualms of patients. Art therapy can be used to treat a plethora of physical, mental, and emotional issues like stress, depression, PTSD, arthritis, eating disorders, and anxiety. Did you know that over 40 million adults in the United States, aged 18 and older, are diagnosed with an anxiety disorder of some sort? These numbers are insane, given that anxiety disorders are the highest ranked diagnosis in American adults. The power of art can help calm the brain and ease the constant nagging feeling of anxiety. Art therapy is also not just limited to crayons, but it can take many forms: sculpting, painting, drawing, coloring, and collage. Not everyone who goes to art therapy has to be an artist. That's always the number one thing that turns people away from art therapy, the constant, oh, I'm not an artist, I could never. I can only draw stick figures, I can't go to therapy for artists. Well, you know what the best thing about art therapy is? You don't have to have a bachelor's degree in studio art to go. You don't even have to be good at drawing or painting. Art therapy is just something there that's a fun, creative, colorful way to seek help in a safe environment. Art therapy, as I explained earlier, is a tool that harnesses the power of art with typical therapy sessions. This creates a form of creative expression that cannot be reached through therapy alone. An art therapist tailors your sessions to you personally, using your issues and struggles to create projects that are ideal in your personal growth. Quoted from the Georgia Art Therapy Association, art therapy can facilitate change and provide coping skills, often with much more clarity than words alone could have provided. Art therapy, facilitated with a professional art therapist specifically, effectively supports personal and relational treatment goals as well as community concerns. Art therapy is used to improve cognitive and sensory motor functions, foster self-esteem and self-awareness, cultivate emotional resilience, promote insight, enhance social skills, reduce and resolve conflicts and distress, and advance societal and ecological change, as quoted by the American Art Therapy Association. Art therapy can be used as a one-on-one session, a couple session, family and community sessions, and they confront issues, cope, and heal with problems. The pieces made by those in art therapy are not only used as conference pieces, which is where you talk about your problems, but also as diagnosis pieces, those that lead to a direct diagnosis of what issues you're dealing with. Now that you know how art therapy works, let's discuss who is eligible to see an art therapist. The short answer is anyone. Anyone can see an art therapist to talk about and express any issues that they may have. The long answer, however, is more extensive. Therapy is not just for people who are mentally ill. Therapy is for anyone who would like to talk about any stressors in their lives and issues that they would like to vent about. Therapists are the vessels that take the material that you give them and transpose that into a helpful message or even medication if you do need it. Art therapy is for the sound of mind as well as the frail of mind and or the body. People with autism, Asperger's, PTSD, anxiety, depression, Parkinson's, stress, all that sorts of stuff are more than eligible to see a therapist or an art therapist. Children who have experienced trauma in a domestic setting or the elderly who have long since forgotten their past and loved ones are more than eligible for art therapy. Anyone who wishes to express the issues they're facing in a relaxing and colorful environment can participate in art therapy. So we talked about that, so let's talk about how art therapy can express what a person is thinking and how it affects the brain. So expanding off the main definition of art therapy, which is using art to heal, how does an art therapist gauge what is and isn't a normal drawing? What is a telltale sign of an issue in art? Those are hard questions when talking about the legitimacy of art therapy. How do they know? Well, there are theories in the use of line quality, color, tonal quality, use of shape and space. So To a person who isn't literate in art talk, this is just a bunch of gibberish. But there's a method to the madness. So, an art piece that has harsh, thick, jagged lines just rammed in there were probably made in anger. Thin lines that are non-saturated tones like blues and grays probably indicate sadness. Bright colors are happiness. Shapes that are round and bubbly can mean lightheartedness, while boxes or rectangles mean solitude. A piece that is cluttered and busy with all sorts of scribbles and shapes and dark colors can mean stress, whereas a single small drawing right in the center can express loneliness. Art stimulates the brain by promoting both hemispheres. That is, the left brain and the right brain. We've been told for a long time now that the left brain is in control of analytics and statistics, hard facts and numbers. The left brain is the nerd that solves all the hard to understand problems. The right brain, however, is the creative, fun, colorful, emotional, and expressive half. So the right brain is very visually oriented, and it sees the whole picture before developing parts of a picture. While people say that the right brain, left brain theory is not necessarily true, we're going to look at it from the perspective that it is in fact true. So, whenever you're making art, you have a visual in your head that you want to make on the canvas. So that stimulates the right side of your brain. You see that whole picture and then you pick out the parts to put on that canvas. The bright colors, the creativity, it practically screams right brain. But how does the left brain correlate to art? Well, hard angles, shapes, they're all part of geometry. Measuring your canvas to scale your drawing promotes the use of the left brain. Even when discussing an art piece, since the left brain is verbally driven, whereas the right brain is visually driven, you're exercising that hemisphere of the brain by talking about your piece and what it means to you. Creating and discussing art both puts use to the two halves of your brain. So, to wrap up everything that I've said in a nice little package, I'll conclude with reintroducing my main points. Art therapy is a form of therapy that allows patients to express themselves, not just verbally, but also artistically. Anyone is eligible to see an art therapist. You do not have to be mentally or physically ill. Art helps aid both hemispheres of the brain, left and right, and artwork gives telltale signs to the troubles that persist patients subconsciously. Seeking an art therapist is okay. It's a way to seek help in a fun, creative, colorful, safe space. Anything that happens in art therapy will take your mind back to that Sunday morning.